Hello, I am Kimberly Blacklock, and I'm going to be giving a presentation on breast cancer. And in this presentation, we are going to be taking a deeper look into what breast cancer is and how it affects the body. So why did I choose this topic? In January of 2021, my gynecologist found a lump in my right breast. I did not know what that meant, and I was honestly really scared. You don't expect to go to the doctor at 28 years old and get told, hey, you have a lump, it's really concerning me, let's check this out. I didn't know a lot on breast cancer or what that meant or lumps in the breast. I had a lack of knowledge, which made me more fearful because you assume automatically that with a lump in your breast, it means that you have cancer. The doctor sent me in for a sonogram first. I went in for the sonogram and she felt around where my lump was in my breast and then proceeded to do a sonogram just like if you had a sonogram for your pregnancy. She pointed out some of the area of concerns. The radiologist came in and he said, oh, this is the area of concern that we have. I would like to go ahead and send you to get a mammogram just to confirm that this is a mass or a tumor. So they sent me across the hall to a mammogram. Mammogram is where it's kind of like an MRI machine, but they specifically take a picture of your breast tissue. So there's these two pieces of glass that they squish the breast tissue down and then they surround the camera so they can get a in-depth picture. They can actually even see the blood flow and the milk ducts and everything inside. The mammogram did in fact confirm that I had a tumor in my tissue that was right above the nipple. I then was immediately sent in for a biopsy of my tumor. On April 11th of 2021, that was honestly the best day of my life. I got the results that while I have a tumor in my right breast, that it is benign, meaning that I am cancer free. I have chosen to go ahead and remove my tumor because I don't want to give my body the opportunity to develop into cancer. So I will be having a lumpectomy in July of 2021. I'm going to be talking about 5 different types of breast cancer: ductal carcinoma in situ, lobular carcinoma in situ, invasive ductal carcinoma, invasive lobular carcinoma, and inflammatory breast cancer. So before I get started on speaking about the different types of cancer, I would like to include some terms and their definitions so you have a better understanding of what I'm talking about. So to the right, I have a picture of a breast, and the duct is where the milk ducts are, and that's what the milk comes through when you are breastfeeding. And the lobules are just underneath the fatty tissue, and that's what makes up the breast. Some terms are necrosis. Necrosis is areas where dead cells are present. Pleomorphic. Pleomorphic is cells that are more abnormal. A mammogram is an X-ray of the breast. And carcinoma is a type of cancer that appears in the epithelial tissue of the skin and the internal lining of the organs. The first type of cancer I would like to talk about is ductal carcinoma in situ, or DCIS for short. This is known as an intraductal carcinoma. Ductal means that the cancer starts inside the milk ducts. This is a non-invasive cancer because abnormal cells have not spread through the ducts and into the surrounding tissue. However, if you don't treat this cancer promptly, it can become invasive and spread to the other tissues. So people who are diagnosed with DCIS are at a higher risk of the cancer coming back or developing new cancer within 5 to 10 years after the initial diagnosis. So the best treatment is to get not only radiation therapy but a lumpectomy. Studies have shown that having breast conserving surgery, i.e. a lumpectomy, without radiation therapy gives you an increased chance of having a reoccurrence at some point in the future. So if you have a lumpectomy and radiation therapy, you have a 15% chance of a reoccurrence. And if you have just the lumpectomy without radiation therapy, you have a 25% to 30% chance of having a reoccurrence at some point in the future. The American Cancer Society states that about 60,000 cases get diagnosed a year. There's two main reasons why this number is so large. One, we're living much longer in our society than we were in earlier times. So the longer you live, the higher chance you have of getting diagnosed with cancer. And two, more people are choosing to get mammograms these days. And the quality of mammograms have improved, which has allowed us to be able to diagnose cancers in very early stages. While there are no signs and symptoms of ductal carcinoma in situ, there has been a small number of people who have reported some nipple discharge. The next cancer I would like to talk about is lobular carcinoma in situ, or LCIS for short. It is also known as lobular neoplasia. This is a type of breast change where cells are present that look like cancer cells are growing in the lining of the milk-producing glands of the breast, but they don't invade the walls of the lobules. It's not considered a true cancer because it will not spread around the tissue. The problem with that is it is typically diagnosed only with a biopsy because it does not cause a lump that can be felt or changes that can be seen on a mammogram, and so it makes it hard to diagnose. And typically LCIS is only found because a biopsy was done for another breast problem nearby. This is an indicator if you get diagnosed with a biopsy, through a biopsy with LCIS, that you might develop a more invasive cancer if you don't treat it. Women with LCIS have 7 to 12 times the increased chance of developing an invasive cancer. And since it's not a quote-unquote true cancer, the only treatment would be monitoring closely, or if you have two abnormalities, which is pleomorphic cells. Those are when the cells look more abnormal, or you have necrotic tissue around, which is areas of necrosis, is areas of dead cells. The doctor would recommend breast conserving surgery to ensure that that was the only abnormality. So we have talked about DCIS, or ductal carcinoma in situ, and now we're going to talk about invasive ductal carcinoma, IDC. This is the invasive cancer that we were referring to if DCIS is not treated. This is also known as infiltrating ductal carcinoma. DCIS differs from invasive ductal carcinoma because DCIS is still contained within the area, and IDC or invasive ductal carcinoma has begun to invade the surrounding tissues. It starts in the ducts of the breast and moves into the fatty tissue. Although breast cancer in men is rare, typically most men who get diagnosed with breast cancer get diagnosed with invasive ductal carcinoma. If not treated properly, it can spread to other parts of the body through the lymph. So this is the most common type, having 8 out of 10 women who are diagnosed with breast cancer have IDC. So some symptoms that typically occur in invasive ductal carcinoma is a lump in the breast, thickening of the breast skin, rash or redness of the breast, new pain in a specific location, dimpling around the nipple or on the breast skin, nipple pain or nipple turning inward, nipple discharge, and lumps in the underarm. Specifically, for my case, I had a lump in my breast that I could feel, and I breastfed for 2 years, so I kind of had an idea of the changes of my breast and how they would feel, and it would get redness and really warm to touch and really hard. So those were some concerns that brought me to the gynecologist in the first place. Once you get diagnosed with IDC, the doctors will go and do further tests, and they'll determine a specific type of cancer that is in your breast and then what stage you're in. And then from there, they'll move forward with a wide variety of treatment options. Some examples of those treatment options may be a lumpectomy or mastectomy. Those are what is considered in the umbrella of breast conserving surgery. You may also do things like hormone therapy, radiation, and chemotherapy. Invasive lobular carcinoma is just like lobular carcinoma in situ, only it's when the abnormal cells start in the lobules of the breast and spread to other parts of the tissue. This can also be known as infiltrating lobular carcinoma. Usually, ILC is caused by increased exposure to female hormones like estrogen and progesterone. This is examples of things that would cause you increased exposure to these hormones would be going through menopause and giving birth to your first child. ILC tumors are harder to detect with mammograms. It's because the ILC tumors grow as single cells lined up in a row rather than clusters. And because of this, it makes it harder to detect on a mammogram. Once you have been diagnosed, there is not very many therapies to treat ILC because this has been a new study. It has just become in recent years a subset of breast cancer. These tumors are more diffuse, so breast conserving surgery is a lot more challenging. So the most first line approach of treatment of ILC would be endocrine hormone therapy. The last cancer that I'm going to talk about today is inflammatory breast cancer, or IBC for short. This is the most uncommon type of breast cancer, concluding about 1% to 3% of all breast cancers. This is an aggressive form of breast cancer. A lump or tumor is not always detected. It usually starts with the reddening and swelling of the breast instead. Cancer cells can also block lymph vessels in the skin and cause skin irritation. Some symptoms may include inflammation, redness, pitted appearance, itchiness, and tenderness. Studies have found that being overweight can make a person more susceptible to developing IBC, and the average age of diagnosis is 57 for white women and 52 for black women. Typically, it's helpful to get diagnosed with this as soon as possible because symptoms can worsen in just days. And the treatments for this is pretty aggressive: chemotherapy, radiation therapy, obviously breast conserving surgeries, depending on how severe the case is. So being 28 years old and getting diagnosed with a benign tumor in my breast, I have learned the importance of giving yourself a breast exam. So in the privacy of your home, at some point today, I would like you to give yourself a breast exam, to male or female, to possibly identify any abnormalities that may be happening, because a lot of people associate breast cancer with being older, and I can now advocate for being 28 years old with a benign tumor in my right breast that it can happen to anybody. So I have included a picture of a self breast exam, and this is to be feeling for lumps inside the breast. So you want to take your fingertips close together and you want to gently probe each breast in one of these patterns. You can start from the outside and rub inwards, pushing some pressure, or you can move in a circular motion using pressure and rub on your breast around the nipple. That one's specifically important because that's where a lot of the milk ducts and lobules are, and that's where my specific tumor is, and so that's an important one. And you can actually feel my tumor when you do that self-exam. And then you can start from right by the armpit and work your way down, because another misconception is if you have breast cancer, it has to be a tumor that's in your breast. It can actually be under your armpit where your lymphs are, and that would still be considered breast cancer. Lastly, we're going to talk about not what we feel in our breast exam, but what we see. Wedges in the breast. You're going to look at your breast and you're going to look for wedges that go almost in a circular motion. You want to look for skin dimpling, which is common if you have specifically breastfed and you have gotten engorged, and you can kind of see how if there's a lot of fluid in there that there's some dimpling. That would occur randomly without being engorged or anything at a random time. That actually happened to me. Change in skin color or texture. Specifically, they talk about the nipple being a different color or the skin around your breast and armpit changing colors. You can examine not only the breast, like I was talking about, but also for changes in the underarm area, specifically not quite all the way up by your arm, but more down in the armpit region and lower. Look for your nipples being inverted or having a different type of appearance. So I hope you guys take the time to do a self breast exam today to hopefully save some lives.